All right, so we've got this medical document you sent over. It's all about how to handle burn patients right when they get hurt. It's pretty intense stuff.
Yeah, no kidding. What gets me is how much it stresses those first few hours. Like, you're not just putting out a fire, right? It's way bigger than that.
You really got to think long game, huh?
Totally. You're setting the stage for how the whole recovery is going to play out. Every second counts, basically.
Easy to forget that when you just see the burn itself. People think, oh, it's just the skin.
Right, but this document, it dives deep, Like, there's this whole other thing. Systemic inflammatory response, they call it. Basically, the body freaks out.
Yeah, throws everything off.
Big time. Temperature goes wonky, your organs are all messed up. It's a system-wide thing, not just skin deep at all.
Makes you realize how important those very first steps are. The stuff they talk about here, it's basic, but crucial. Like stopping the burning process, duh, but then you got to cool it down, running water, right?
And not for a second either. That's where people mess up. This document, it says almost half of adults and like 40% of kids, they don't get the right first aid for burns.
No way, seriously. I had no idea it was that common to screw it up.
It's huge, and that's just basic stuff. This document, it's really hammering that home.
Makes sense, though. Like you said, every second matters. So with the cooling part, they say 20 minutes, full 20. Why so specific?
So it's not just about the surface feeling cooler. 20 minutes, that's like the magic number for getting that inflammation under control. You're buying the body time to deal with this massive trauma it's just gone through.
So it IS deeper than just, oh, this will stop it from hurting as much then.
Totally. Simple action, but what's happening inside is huge. Like hitting the emergency brakes when things are about to go really bad.
I gotcha. Damage control from the inside out.
Oh.
But then there's that other thing, right? It's almost sneaky how this document talks about it. Inhalation injury.
Ah, yeah. That's the silent killer right there. You don't always see it right away.
Breathing in the hot stuff, the smoke.
Yeah.
That can't be good.
Not good at all. Really messes up your lungs, your whole respiratory system.
Yeah.
And the signs. Tricky.
Not like it's always obvious, right?
Nope. Document mentions coughing up this sooty stuff, your voice gets raspy. Even, like, your brain acting weird could be a sign.
But who's going to think, oh, my brain's foggy, must be the smoke inhalation right then and there?
Exactly. Easy to miss, and that's the problem. This document, it's like flashing red lights around this. First responders got to know what to look for because they got to act fast. It says here, if there's even a chance the airway's messed up, you go straight to intubation. Better safe than sorry,
Big time. Okay, so we've stopped the burning, cooled it down, make sure they're breathing okay. What's next in this whole process?
Buckle up, because this is where it gets even trickier. We got to talk about fluids. This document, it's all about something called the Parkland formula. How much fluid a burn patient needs. Sounds simple, but...
But there's always a but, isn't there?
Oh, yeah. Whole lot of history behind this formula, and not all of it's pretty.
Before we get into that, though, why do they need so much fluid anyway?
Okay, so think of it like this. Big burn, you're basically springing leaks everywhere.
Yeah.
Not just the skin, right? Fluid goes into surrounding tissues, too. They call it third spacing. Body can't handle that, leads to hypovolemic shock.
And that's, like, really bad.
Life or death, my friend. Circulatory system crashes, no fluid, no party. So this Parkland formula, it's supposed to help doctors figure out exactly how much they got to pump back in to avoid that.
Makes sense. Sounds like walking a tightrope, though.
You have no idea. See, giving fluids, that's only half the battle. The document, it talks about this other thing, fluid creep.
Okay.
Basically giving too much.
Hold on, too much.
Yeah.
But they're losing it, right? Wouldn't more be better just in case?
You'd think so, right? But too much, that's a whole other mess. Pressure builds up, organs get squished, heart can't handle it. Imagine overfilling a balloon. POP goes the patient.
So it's like this balancing act. Too little, they crash. Too much, they crash.
Welcome to the world of burn care, my friend. It's all about finding that sweet spot, and trust me, we're just getting started.
This whole thing makes you think, right? It's not just about slapping a bandage on it and calling it a day.
Oh, not even close. That's something this document really makes clear. You got to treat the whole patient, not just the burn itself. All this other stuff matters just as much.
Like what? Give me the highlights.
Well, they go on and on about early nutrition, getting that right, and pain management, obviously. Plus, all the things you got to do to prevent things from going sideways. Blood clots, ulcers, that kind of thing.
Right, because the body's working overtime to heal. You got to support that, not just the burn itself.
That's it exactly. They even have specific guidelines here. Like burns over 15% of the body. They need nutritional support within 24 hours max. But here's the kicker. No TPN, says it right here, black and white.
Seriously? Why not? I thought that was, like, the go-to for this kind of thing.
You'd think, right. But studies show it can actually make things worse. Higher death rates, in fact.
Wow, that's wild. Makes you realize how much you don't know, even about the basics.
It's a specialized field, that's for sure. And speaking of specialized, we got to talk about surgery. And every burn needs it.
Right.
Yeah?
Some are worse than others.
Way worse. This document, it makes a clear distinction. Little burns, surface level, they'll heal on their own, but deeper ones, you got to get in there, hands on.
That's where they do the debridement, right?
Yeah.
And skin grafts, all that.
Exactly. Clean out the dead stuff so the good stuff can grow. Then you take healthy skin, transplant it over, gives it something to rebuild on. Pretty amazing when you think about it.
It is. Although there's that other thing they mentioned, escharotomy. That sounds kind of freaky, if I'm being honest.
Yeah, that's the heavy-duty stuff. Okay, imagine this. Bad burn. Right, but it's all the way around, like a limb or even the chest. That burned skin, they call it eschar, it dries out, gets tight.
Like a really bad sunburn, but times 100.
Except imagine that sunburn is now a tourniquet, cutting off blood flow. That's what escharotomy fixes. They cut through it, relieve the pressure, saves limbs, sometimes lives. This document makes that crystal clear. You gotta be ready to do it, no hesitation.
Intense. Okay, so you've got how bad the burn is, how much of the body it covers, and then you got to pick the right dressing for it, too.
Oh yeah, dressings are a whole other world. This document, it's got opinions on all of them. SSD, Acticoat, Mepilex-Ag, each one's got pros and cons.
I wouldn't even know where to start. It's just a bandage, right?
You'd be surprised. The depth of the burn matters, where it's at on the body, chance of infection, even the patient's lifestyle. Can they change it themselves, keep it clean? It all factors in. Got to find the right tool for the job, just like anything else.
Makes sense when you put it like that. But wait, it gets even more complicated, doesn't it? What about those specific types of burns? The document mentioned facial burns, electrical burns. Those are different beasts altogether, right?
Totally different. Electrical burns? Those are tricky. See what you see on the outside. That ain't the half of it. You could have a tiny burn where the electricity went in and out, but inside.
It's like that saying, the tip of the iceberg.
Exactly. You don't see the damage underneath. Muscles fried, nerves shot, even organs can get messed up. And because of all that, electrical burns, they love to throw curveballs, like compartment syndrome.
That just sounds bad. What is that exactly?
So your muscles, right, they're wrapped up in this tough stuff, like sausage casing, basically. Compartment syndrome, that's when the pressure builds up inside that casing, swelling, bleeding, whatever. It's trapped.
And it gets squished in there, basically.
Basically. Blood vessels get pinched off, nerves too. Hurts like hell, and it can be really dangerous.
I bet. So what do they do about that?
Well, if they catch it early enough, they can try to relieve the pressure. But sometimes, surgery is the only option. And this document, it doesn't sugarcoat it. They make it clear. This can be limb-threatening stuff. We're talking amputations, even.
Intense. See, this is why electrical burns are so scary. They're sneaky, you know? Like, there's this whole other layer of problems you got to worry about. And then on top of all that, the document mentions this other thing, myoglobin.
Ah, right. Myoglobin. Okay, so muscles, they have this protein in them, right? Myoglobin. Get a bad injury, like a really bad electrical burn. That myoglobin leaks out into the bloodstream. Little bit, no big deal. But a lot of it.
That's when things go south.
Big time. Kidneys, they do not like myoglobin. Can really mess them up.
So you're dealing with potential muscle damage, nerve damage, kidney damage. I'm starting to see why this document spends so much time on electrical burns.
And we haven't even touched on the mental side of things. I mean, think about it. The trauma of the injury itself is bad enough, but then you add on the potential for scarring, disfigurement.
Right. It's not just a physical thing. That's got to take a toll.
Absolutely. And that's something this document emphasizes really well. It's not enough to just treat the burn. You got to treat the whole person, their mind, their emotions, everything. And that takes a team, right?
More than one expert, for sure.
This document, it hammers that home. Multidisciplinary approach, they call it. Doctors, nurses, sure, but also therapists, nutritionists. Everyone's got to be on the same page. Working together, that's how you get the best outcome for the patient.
It's like a well-oiled machine, right?
Yeah.
Everyone's got their part to play.
Exactly. All those moving parts working in sync. That's how you help someone recover from something like this.
Man, we've covered a lot of ground today. From basic first aid all the way to this really complex stuff. It's clear burns are no joke.
Nope, not at all. They can really turn your whole world upside down. And that's what I hope people take away from this, you know? This deep dive, burns, they're more than skin deep. They affect everything.
For sure. Well, on that note, I think we've given everyone plenty to think about.
Until next time.
Stay curious, everybody.